Hello, it's Julie, owner and PT of Lady Bits Physical Therapy. Today I'm making this video because I had a request from someone, one of you, requesting specifically help for tailbone pain or coccyx pain. So let's talk about that. So welcome to your pelvis, and I've grabbed the tailbone, attached to everything else it's attached to. Let's flip things around and just kind of cover the anatomy. So I'm going to zoom way in here. So what you see here, here's the sacrum. This is an ilium, and this is an ilium. So right here we have a sacrum, and attached to that sacrum, although my model's not the greatest in the world, is your coccyx, aka your tailbone. So you notice this teeny little bone coming right off here. There's a joint right there that it attaches to. But you'll also notice all the muscles that are attached to the tailbone. I really want you to see this. So there's the tailbone there. We can flip it over. We can see it from that point of view. There's your tailbone. And we've got all these muscles that are coming right off the tailbone. So we have coccygeus on one side, and ischiococcygeus, and even pubococcygeus coming all the way from the pubic bone, pulling all the way back to the coccyx. So there are lots of reasons why someone can have tailbone or coccyx pain. It can be that you fell and landed hard on your tailbone, you got bucked off a horse, or you had a baby. There's so many different reasons that could end up with tailbone pain. Some people actually fracture their tailbone during childbirth, or some people just have a really difficult time with delivery, and then afterwards they have tailbone pain that seems to linger and linger and linger and linger even years after birth. So today's video is for the person who reached out to me on the other side of the world that says, I don't have any pelvic PTs where I'm located. What can I do for myself? So this is specifically for someone who does not have access to a good pelvic floor physical therapist who can help them. Again, I always encourage every one of you to try to find someone local to you that can help you, because pain is never normal. But if you're stuck and you've just got to try something, here are a couple recommendations I have. So one is to acknowledge that that bone, that little painful tailbone, is attached to your pelvic floor muscles. This is your third layer of pelvic floor muscles. This is the hammock or the lifter muscles. So these are the muscles that support the pelvic organs, the bladder, the bowel, or I should say the rectum, and it's obviously a passageway for the vagina. So these are your deep pelvic floor muscles that are attaching directly to your coccyx. Now, the more superficial pelvic floor muscles don't attach to it, so I'm not really going to talk about those. These are the squeezers. Don't pee in the pool, don't fart at the party. We're not talking about those here. We are talking about the lifters, because they do attach right to that tailbone. So what a lot of people tailbone pain have is pain with sitting. So they may end up like this, or you might end up like that. So we have a couple problems to solve. If you have pain with sitting, it means you're not sitting straight, because you're kind of here or you're kind of there all the time. So when you get in that habit of sitting kind of here or kind of sitting there, you're starting to throw your pelvis off. You're starting to throw the line of pull on your muscles and your fascia and your ligaments off. If you habitually are doing this all the time, eventually all the muscles on the side of the hip are going to get really short, and you're just going to find that you're feeling uncomfortable a little bit of everywhere. So the other thing women tend to do, and men as well, is they will curl the tailbone underneath them, and they'll slouch sit. In other words, you end up sitting on your sacrum because you're really trying to avoid that direct pressure onto that coccyx or that tailbone. So you end up kind of curling under and sitting on your sacrum, which is not really comfortable and not something you can do the rest of your life. So step one, how to alter your chair or your sitting environment so you can sit without pain, so you're not creating other issues. So I recommend a very cheap, accessible towel. I'm gonna fold the towel. We're basically gonna make a U. You saw how not fancy it is? It's really not fancy. And we're gonna, did I say U? I meant V. So we're gonna put this V on the chair, and we're gonna sit right on it. Now I didn't fold mine thick enough, so now I'm actually gonna take it out and refold it even thicker. And you might find that you have to kind of toy around with your stuff at home too. So fold, and I'm gonna make some kind of thirds. I want a nice little shelf. So now I'm kind of creating a thicker shelf. So I'm gonna make a nice little V. You may have already figured this out for yourself. That's so relieving. You might find that by supporting your sits bones or your ischial tuberosity, these lovely bones, with a folded up towel, that now you no longer have direct pressure on your tailbone. So now, with your handy folded towel, instead of having pressure directly on your tailbone, you're putting more pressure on these bones, so that we're really relieving if there's been inflammation, if there's been chronic pain in that tailbone, we're just gonna take the pressure right off. So for the low cost of a hand towel, you can make yourself a nice little wedge so your tailbone's kind of floating in that space and your little ischial tuberosities are supported. I like that because it's free and it's cheap. Next thing is we have to address the mechanics of what's yanking on that tailbone. Did it get pulled way under? Because we tend to find that in a lot of my patients, that what's happening is their tailbone, for whatever reason, could have been the mechanism of injury, but it gets kind of pulled way under and it's really at this extreme angle. Sometimes it's way out, but a lot of times we're finding that they're way under. So that's where a good therapist comes in. They can actually go in rectally. This sounds worse than it really is, but you can find a therapist to go in rectally and palpate that tailbone, one finger in, one finger out. So you're really right on top of it. So one finger on the outside, one finger on the inside, and they can actually do a little adjustment and kind of straighten out that tailbone if it's been pulled way under. We can kind of pull it out. Now, if you don't have access to a therapist or someone that can do that for you who's licensed, we have some other alternatives to get at these little muscles here and here so that the pull on the tailbone is equal. The other issue is sometimes the tailbone gets yanked at an angle. It goes this way or it goes that way. And you may even feel it on yourself as you're exploring yourself and kind of putting your hand down there and palpating, you know, how does that tailbone curl? As you reach around, you might find, oh, it's really kind of going to the right, or oh, it's really going to the left. So I encourage you to just kind of palpate, run your hands down, kind of run them right down here, down the sacrum. You're gonna feel like you're falling off a cliff and you're heading right towards your rectum, because you are. And you're just gonna palpate right down there, palpate, 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 until, can you feel that tailbone? Do you notice? Does it veer off to one side or does it veer off to the other? Because that can give you some insight as to which muscles we need to target to kind of release a little bit so that there's not a unilateral pull on the tailbone. So if you're finding that it's pulled way up inside of you, or way to the right, or way to the left, there are some things you can do at home to try to change that a little bit. So one of my favorite things is sitting on little balls. Sometimes it can be very tender, so you really have to listen to your body. But ideally is what we tend to find, if you don't have access to someone to do internal work, is when we go internal, and this is me entering the kind of vagina basically, is when I'm inside a lady, and this is kind of where I'm at in my mind, I will often run my fingers along these muscles, and I want to feel that they're nice and soft and happy and squishy and that there's no pain. You know, I really want them to feel really squishy, like the inside of a thumb. You don't want them to feel like a hard brick wall like that. You want them happy and soft and squishy. But ladies with tailbone pain who I work with, very often I'll palpate these muscles right next to the tailbone on one side or the other, and I find that they're really taut and they're tender and they're not really soft and squishy. They're really quite hard. And if, this used to be one of my issues too, if you're one of those ladies whose deepest layer of her pelvic floor is all nice and tight, it's really hard to know it. It's really hard to know. You don't know that you're walking around with a really tight pelvic floor. You just know you have stress and TMJ and all these other issues. But it's really hard to know, is my pelvic floor relaxed? The deepest layer inside of me, is it really relaxed? It's hard to feel. So here's how we're gonna find out. If your tailbone is getting a yank to the left or a yank to the right, one thing we can do is try to stretch specifically the muscles that attach to that tailbone. So if the muscles are pulling it one way, or if the muscles are pulling it the other, say all these muscles are short and pulling it north, I want to teach you a way that you can give yourself a stretch on those muscles and see if that helps. So here's how I like to do it. I like to use a ball, about yay big. So the idea here is I'm going to be sitting on the ball. I'm gonna demo exactly how I do it. And as a side note, this is how I teach women how to prepare these layers, the third deepest layers, for labor and delivery, because we want them nice and soft and flexible. So this is actually a stretch that I have all my pregnant women do, especially in that last trimester, to really prepare these layers to get ready to open up and deliver a baby. So we're gonna use that same technique to treat the tailbone since you're kind of stuck at home and you don't have any options. So this is the orientation. I'm gonna come really, really close here because I really want you to see what's happening. So here's the bone you sit on. Let me tip it forward to give you an idea. So here's the front of your pelvis. Here's the bone you sit on here and here. So we have our sits bones, and then we have our internal anal sphincter. And right between the bone and the sphincter, you've got these muscle bulks. And so ideally, we're gonna put the ball right between the bone you sit on and your rectum. We're gonna turn straight up and down, and we're gonna sit on it. So here's how I feel that for myself. I will actually start on my left side. I'm gonna palpate. There's that bone, I can feel it, the bone I sit on. I'm gonna place the ball between, here I go, between the bone I sit on and my butthole. Very honestly, this is how I teach my patients. Really, truly, the ball is right in between the bone that I'm sitting on and my butthole. And there feels like there's a little overlap with the butthole, but I'm gonna go with it. So as you can see, I'm kind of wiggling and kind of settling on. So, aha, there. I have a ball currently driving up one side of my pelvis. Where'd my muscles go? Oh dear, they just fell. Okay, so the ball that I'm sitting on is currently pressing up against one side of those muscles. So in this position, you should feel like you have a fist kind of going up your pelvis. Now, from here, we breathe. Inhale, make sure your belly fills with air. Exhale, and melt over the ball. Inhale. You're probably gonna feel more pressure with the inhale, and exhale. Melt over that ball. This is gonna be a long, slow stretch. If you're anything like me and your piriformis on the left side of your hip is holding on for dear life, it's gonna take you longer. I have a lot of piriformis issues on my left side, so it's really tight. So that ball is slowly stretching my muscles. I can feel it slowly trying to get in there. You may find that when you put the ball on the other side, that it just goes whoop and goes right in. So one side might be tighter than the other. We're gonna stay here for a good minute. Just breathing, and you'll notice on the inhale, you'll feel more pressure where the ball is at, and exhale. So what we're really trying to do here is release and let go of all the tension around that tailbone, around all the muscles that attach to that tailbone. You shouldn't feel like you have to grip. This should not be causing pain. It should just feel like a slow, deep stretch. And actually, as the minute goes on, you may notice it doesn't even hardly feel like you're sitting on anything anymore because you can't even feel it. Awesome, good job. So if it's been about a minute, I'm gonna pull it out and just take a minute to appreciate how the side feels that you just sat on the ball. So for me, I feel like my pelvis bone just went whoop over here. I feel like I really opened up on this side of my pelvis. So now I'm gonna flip it on the other side. So again, I feel for that bone that I sit on. Here's my butt. There's the bone I sit on. So I'm gonna put it right between that bone and my butthole. Wiggle around a little bit, kind of feel like I nuzzle it. Oh yeah, this is my good side. It just whoop, goes right in. And again, I'm gonna breathe and let go. You may find that you need to do this twice a day, 3 times a day, for several days, if not even a couple weeks, to really reset these muscles, reset your brain's connection to those muscles. Your brain might think that they're normal, all short and tight. And so we might need to do a little brain retraining of no. We're gonna lengthen and breathe and nice and long. And it should get to the point where after a couple weeks of doing this, you can put that ball and you can sit on it and it feels like nothing if you're really consistent. So, something else to know, these muscles, these are your lifters. So when I've talked about the Kegel in the past, I've said it's a squeeze and a lift. You squeeze, you close the doors, and you lift, like you're lifting an elevator, and that's referring to those lifters. But I want you to know, activating those lifters that we've gone over in the past, that happens as you exhale and pull your belly button in. So you may notice if you just did that with me, inhale, let everything go. Exhale and gently pull your belly button in. You're gonna feel it get really tight underneath that ball because those little lifters are getting activated. So if you've had chronic pain for a while, and most people who have chronic pain tend to be in a holding pattern. They're holding in their stomach and they're breathing in their upper chest. What that means is if your belly button's pulled in, these muscles are gonna be pulled tight all day long. If you're trying to like pull your stomach in all the time to look skinny, these little muscles, they're gonna be pulled tight all day long, and it creates so many problems down the line. So let's think more like dogs a little bit. They don't hold in their stomach all the time. They have good posture, but they're not always holding in their stomach. So as we're thinking about ways to kind of help relax all these muscles that attach to the tailbone, can you have a soft belly? Let it go. You'll notice that in a lot of my videos I wear really loose clothing, and it was because I habitually held in my stomach all the time from like, I don't know, 4th grade into early 30s. So I gave that up so that I can relax my belly, so that I can have a happier third layer to my pelvic floor that's more flexible. And other ways of having a tip that these muscles might be a little too short and tight is for some women, and this was my history, painful intercourse, because the penis is actually hitting those muscles at different angles. So a good tip is if you have a lot of pain quadruped on your hands and knees with intercourse, consider these muscles may be part of what's driving that pain, because in that position the penis comes from behind, and as you can see from here, if the penis is coming behind, it's jamming right into those muscles. So if they're short and tight and you jam something into them, it doesn't feel good. If we want to lengthen, then we can sit on the ball. I'm still sitting on the ball over here. If we want to lengthen, we can practice relaxing our belly more often, breathing into the diaphragm. So diaphragmatic breathing means we're breathing into the lower rib cage, and it opens up like an umbrella. So this may not be everything you need to solve your tailbone pain, but I really hope that it helps you. I hope that just getting in touch and starting to feel these muscles and make the connection between your brain and the bottom of you, and trying to learn based on what ball you're sitting on. Ooh, I have one side that's really tight and one side that's not. Well, maybe I'll focus on the tight side and every day and continue to let it go. And in between those times, use a folded up towel to sit on so you're not constantly aggravating a tailbone that's trying to learn a new position. Now there are nerves and there are ligaments, so this is not the end all be all to tailbone pain, but this is my best recommendation if you're stuck at home and you've got nothing but yourself, of a really good place to start. 1, get the weight off of it by sitting on a folded towel. 2, let's start working on the muscles that attach to it. 3, let your belly go. Practice diaphragmatic breathing, because every time you pull your belly button in, you're shortening these muscles. And I don't want to say that to make you fearful of using your muscles and engaging them appropriately with movements, mechanics, exercises, and all those things. Yes, we have to use our core, but if you're someone who's stuck in chronic pain, chances are you might be clenching all the time. So try to drop the shoulders, relax the face, and try to relax all the way down as much as you can. I hope this helped you. Let me know, and until I see you again, thank you so much. Take care, like, subscribe, and share, and I'll see you soon.